So, Unit 8, Journal Assignment. So this was just a new psych evaluation. Again, not a new diagnosis, but this patient came to the office for a psych evaluation for anxiety, depression, ADHD. He said that he can remember having these problems since school, grade school. So he states that he remembers getting in trouble as a child, being disruptive and not listening. He states that now as an adult, he feels like he needs to get help because it is affecting him at work and in school. Work and at home. He states that as a child, he witnessed his dad drinking and abusing his mom, and also abusing him as a child. So he stated that he was currently taking Strattera 25 milligrams, and it was not helping that much. It helped some, but it didn't help quite that much. So he needed something. He just needs something to help him with school and, work. I don't know why I keep saying school, maybe because I'm in school. He just needed something to help him with work and school, and then he needed something for his anxiety and depression that he suffers from. And so this here, when you think about it, reflect, or and you're educated on these diagnoses, you know that things that happen in your childhood can affect you as an adult. So him being probably depressed about his dad physically abusing him and his mom, and him witnessing it, anxiety from the anticipation of the dad drinking, knowing that it would lead to abuse, physical abuse. So he had that ever since he was a child. So therefore, without counseling or therapy or something to help you learn strategies to deal with to learn strategies and coping skills to deal with those things as anxiety and depression, it's most likely going to follow you to adulthood. And so he's 25 now, and he is still dealing with these problems. Strattera, it's an SSRI, and it helps with depression and anxiety. My preceptor just increased his Strattera, being that he said that it was working, but not that much. So he increased it to 100 milligrams. He also gave him Intuitive, which helps with the hyperactivity. And then he also prescribed the Prozac, 20 milligrams. I don't question, their prescribing methods or whatnot, but Prozac and Strattera is both an SSRI, and I'm just thinking, a serotonin syndrome. But You know, they've been doing this for a long time, and I guess they know what to look out for. And that's what was given. And so the patient is to follow up in 2 weeks, because when you prescribe a new medication, you really want to follow up 1 or 2 weeks to make sure that the patient is not experiencing any unwanted side effects. In this case, especially serotonin syndrome, being that there's 2 SSRIs given to this patient. So that's that. It's nothing new. It was just a little scenario and how, you know, things that happen as a child, how it can follow you to an adulthood. Thank you.